Hey guys, Dr. Mike here. I want to talk today about children and coughs. Well, it doesn't have to be just children, but I want to focus on the children because I find that with most of my patients, they are more tolerant to let their condition go before they intervene. But with children, they want to intervene right away. And the reason that is because we don't want to see our children suffer. So I get that. I've got kids of my own. But the problem is when we intervene early, we actually undercut the immune system's response to things. So let's decide now once and for all that a cough is actually a way for a body to expel something that is trying to get rid of. In other words, it's something that needs to happen in order to get rid of something that's in the body, in the lungs, that doesn't belong there. So it triggers a response. And so what we do is we give cough suppressants. And some of us, when we give cough suppressants, we're suppressing the immune system's ability to function. And that can confuse an immune system. If you do that too often, a confused immune system can cause other more serious conditions later. And I talked about that during the fever video that I did not long ago, and you should check that out because it's really good. I go into detail about a fever. But with a cough, cough expectorants, cough suppressants, and understand if the cough is unrelenting and really, really difficult and the child can't sleep or breathe, that's a different story. But one of the things that I found to be really effective for coughs is not only, rest, good nutrition, and all the natural things that you can do to help your child be healthy, but also stimulating what's called the cardiopulmonary nerve. And where that is, it's right here. It's these green nerves that come out of the middle of the upper back. They go to form a branch called the cardiopulmonary nerve, and that nerve goes to the heart and lungs, and that causes sympathetic distribution impulses. In other words, this is the fight or flight response, responsible for bronchial dilation, right? Dilation of the bronchioles to let you breathe better. So what we found in chiropractic is that if we stimulate this area, if there's an imbalance here and we stimulate it, and the way I like to do it, especially with children, is with a little gentle vibrational tool. It's called the vibrational neurological hammer. And we could change the frequency of the beats. But what we do with this instrument is we place it very gently on that part of the spine. And we use the vibrational frequency to stimulate and open up the nerve channels that feed the cardiopulmonary nerve. So as we stimulate and open up these nerve channels, now the brain can communicate to the body, and the body can communicate back to the brain to open up the bronchioles, to allow them to expand, to dilate. Dilated bronchioles is what you want. So we found that to be very effective and very beneficial. We've also found things like ginger and scallion and those type of herbal things and natural things to make a tea with that or to make a soup with that is very helpful for coughs as well. So I hope that helps. And remember, stay informed and get adjusted.